Hi, my name is Katie Beaulieu, and I will be doing a case analysis prompt. So, this case analysis was being presented on a 54-year-old male who was complaining of dizziness, headaches, but then he also was experiencing some right sided tinnitus. His other history showed that over the span of the last 3 weeks, his conditions and his symptoms were progressively getting worse. But then, on top of that, some symptoms that were showing, other than the dizziness and headaches, were balance issues. And then, upon further tests, some abnormal Weaver and Ryan test results, and then also a MRI result of the finding of a 2 centimeter mass on the internal auditory medius. The next part of our task was to analyze some medical terms. And so, like I said in the first slide, tinnitus or tinnito and the suffix us, which both would mean ringing condition, is mainly present in the ears. And I can imagine many people today experience that. The other word that I wanted to do was neuroma, which having the root of neuro, meaning nerve, and the suffix of oma, meaning tumor, shows that there was a tumor on the nervous tissue in this case. And for this 54-year-old man, it did show that it was a benign tumor of the vestibulocochlear nerve. The next word that I wanted to do was gadolinium, which is gadolinium is a chemical element used in a contrasting image, which is mainly used in MRI scans, as it enhances the visualization for soft tissues and tissues in general. So then we can be able to differentiate abnormalities in the tissues, such as tumors and tears in other conditions. The other part of the test that we had to do was to find some common medical abbreviations. And so I chose an MRI, a BP, and ENT. So an MRI is a non-invasive imaging technique system that is used in that uses magnetic fields and radio waves to be able to generate images of internal structures. And in this case, they were doing it on the auditory nerve to be able to rule out the tumor that they found. But then overall, MRI does stand for magnetic resonance imaging. The next one that I did was BP, and this one's pretty common to most everybody, but it purely just means blood pressure. And this is just the measurement of the arterial pressure. And the differences in these is depending on the high and low of this blood pressure, it can ultimately determine some conditions and what the symptoms of those conditions may be. And then the last one that I did was ENT. And then this abbreviation is mainly part of a specialty, such as there are ENT nurses and doctors out there in the world, which, to be more specific, ENT does mean ear, nose, and throat. But then aside from that, ENT does not just deal with those, but then it can also relate to other structures such as the head and neck. And in this case, that is what they were looking at. So then the next test that we were to do is to look at the possible diagnoses that were a part of this case and what they could be. And the most likely diagnosis in this case for this 54-year-old male would be an acoustic neuroma. This is due to the progressive unilateral tinnitus and the hearing impairment that he experienced, where his daughter and his wife had expressed that they could not get him to hear them even when they were just sitting in the car right next to him. And then obviously, like we had said in the previous slides, the MRI imaging of the 2 centimeter mass on the internal auditory meatus. And then also, the patient didn't show any other neurological defects that suggested that he had another condition. Some rule outs for this condition were due to the fact that he didn't have any signs of an episodic vertigo. There was no evidence of a metastasis from another primary tumor. And then, unfortunately, because his migraines did not improve nor respond to any of the medications, um, they could be and could also not be part of this um, diagnosis. And then the last thing that we discussed was the significance of medical terminology. Obviously, there are way too many reasons as to why medical terminology is significant, but some of them are as follows, which are how it reduces the potential of medical errors in not only diagnosing, but also just like treatment plans for patients, and then communication between doctors and nurses. Um, it enhances a patient's safety by preventing misinterpretation when doctors and nurses are talking to them. And then it also helps prevent the misinterpretation when medical conditions and diagnoses are brought into play. And then it also standardizes patient care by ensuring clarity and accuracy in medical records and information, in which are all open to everyone who has been in a medical situation. They all have access to their own records. And the more accurate that they are, the better understanding that everyone will have in every situation. And then, like I said, there's too many reasons that I can't list. This entire slide would be full. But that is the end of my presentation. I thank you so much for listening, and I hope that you have a great day. Thank you.